Hello and welcome to Global Sports Care. I'm delighted to have my interview partner today, Dr. Ben Sinclair. The subject is a very interesting one because it's a hot topic. Despite having had now 4 years of COVID-19 issues, our subject today is long COVID in athletes. Dr. Sinclair is the founder of the Finlay practice, which started in Birmingham, and this is one of his locations next to Leeds and London. Hello, Ben.
Good morning, Marcus, and thanks for having me on.
Can you tell me a little bit about yourself and what got you interested in long COVID?
Thank you. Yes, so I am trained as a GP in Britain. And I was practicing as a private GP and also working in the prison sector when I got acute COVID myself, became very unwell. I then tried to go back to exercise, but really struggled. And at that time, I was training for a triathlon. And then about 3 months later, I had a left-sided sort of neurological event, which I now know probably was a microclotting stroke. And I developed long COVID myself. Prior to this, I had an interest in allergy medicine and in immunology and chronic fatigue. And so I had to work my way out of this hole I'd fallen into with severe long COVID over the next 3 months to try and recover myself. And I'm a functional GP, so I looked at all kinds of both medical and non-medical and lifestyle issues to try and recover, and did a lot of research. I then found that I knew a lot about long COVID at a time in July 21 when not a lot of people knew what was going on. And so I then dedicated my clinical practice towards helping people with long COVID who were not being looked after. And so we started one of the first online long COVID recovery clinics. And I've now seen hundreds of patients and including younger people as well.
Great. And obviously, with long COVID, is there much research about what are the theories, what causes long COVID? Can you tell us a little bit about that?
Yes, thank you. Well, long COVID really is the epitome of a very integrated illness. We didn't really know much about what was going on when it first presented. Lots of people were struggling with neurological problems, with fatigue being the biggest symptom that presented, and I myself couldn't even walk around the room without having to lie down. We now know from research from Dr. LAUPHEIMER and Professor Pretorius in South Africa that long COVID primarily occurs through microbes. So it actually is almost a blood vessel disease, and this causes lack of oxygen to all tissues in the body, and as a result, we have all kinds of malfunctions in all systems. Primarily the allergy system. So mast cells become hypoxic, low in oxygen, and they then release their histamine and create all kinds of new allergy responses. They sensitize pain nerves. And we also have, obviously, hypoxic problems with the brain, which needs a lot of oxygen. And so we have neurological problems and dysautonomia, which is malfunction of the nervous system. But then we also have a big hit on the gut microbiome. And that's where my functional interest came in, because prior to getting long COVID, I was really interested in performance. We were looking after high-performing people in the business sector and also people who wanted to improve their athletic performance. And of course, the gut microbiome underpins all sorts of performance issues. And so you need to make sure you care for your gut microbiome. Some of those key bacteria involved in processing histamine or in the immune response get used up in acute COVID. If you don't put them back, then you're still vulnerable to all kinds of other inflammatory problems as a result of gut and gut dysbiosis. There's sort of 3 primary systems there that tend to go wrong. And when we look at people in a holistic, integrated way, we try to look at their symptoms, match up which system is more dominant, begin to control symptoms, but actually deal with the root cause, which primarily comes from this microclotting or an autoimmune.
Okay. So obviously often it's not clear which symptom is the most prevalent. But would you say this all starts in the gut, or would you say it all starts with the clotting first, or is this unknown?
Well, it's very interesting. I think they both happen simultaneously. So in an acute COVID infection, a lot of different bacterial subtypes get used up in the response to try and engulf and destroy and take out your COVID pathogens. But viral debris left over from the dead virus, and indeed lots of viral COVID spike protein left throughout the system. And so if you don't mount an immediate antibody response to that, that will stick around and will begin to cause microclotting. So we know that in acute COVID, people were dying not from lung problems, but actually from use clotting disorders and clogging up their pulmonary circulation, and that's why people were using oxygen to get it in. It wasn't a breathing disorder, actually a blood vessel disorder. So there's a huge amount of microclotting at first in the immune response with this cytokine release, with a big storm of inflammatory chemicals in the initial response. But then with long COVID, what you find is that over time, the immune system gets worn down and stops producing a sort of healthy antibody response. And then also the microclotting continues. And if you have had acute infections maybe 1 or 2 times, plus some vaccinations, you're going to be producing a lot of COVID spike protein, and the risk of microclotting will increase. Now, I think you asked earlier about the evidence for these sort of things. So microclotting is well described in the literature in studies. A recent study in Sheffield is demonstrating, as confirmed in South Africa, all participants who applied to the study long COVID, whether they were randomized to blind no treatment or to treatment, they all had microclotting on their microscopy of their initial. So microclotting is a major factor at cellular level, but the systems that go wrong, they tend to flux and change. So it's been quite an interesting adventure to understand, both looking about myself and how my system developed and my symptoms, and in my patients, how at different times in the illness, different systems begin to manifest problems as the illness progresses. And so you've got to work out where you are in that progression and treat those symptoms to calm them down, enable the patient to be able to function, because a lot of my patients are either bedbound or unable to leave their home, or using a wheelchair because of such crushing fatigue. And we know mitochondrial disorders play a big part. So the mitochondria, the energy producing part of the cell, has a lot of problems too. And that we think that's also to do with a lack of key through and not being produced or metabolized by the bacteria that have been knocked out by the COVID. So there's so many things going on in this. It's been a really interesting learning journey, and I think we're learning so much more. So much more research is needed because we're really at the cutting edge at Dr. Finley's of demonstrating protocols and providing those, and working with people around the world who are at the cutting edge of treatment of this disorder, because there are a lot of different theories, and around the world you have different experts. Some of them believe in microclotting, some of them don't. Some of them think it's live virus persistence. Is the virus still in your body? Some people believe that it's all autoimmune, and some people believe it's all allergy. And so as we go on, we're learning that these things are all interlinked.
But all these theories lead to, in a way, chronic inflammation. This is one thing. And then this chronic inflammation also makes your immune system weak. And then one theory is that due to this, you reactivate old viruses. Can you tell us a little bit about that?
And this is what really was interesting, because as I got better from long COVID, other people were not getting better at the same speed as I had. And I was very lucky to have the right knowledge to apply these lifestyle and holistic principles to my own recovery, like cold water immersion, Wim Hof breathing, and changing my already relatively healthy diet to lower histamine and to a low gluten, low irritation, low inflammation diet. But so just remind me of that question again. The question.
Reactivation of old viruses.
Yes,
basically.
thank you for getting me back on track. So the reactivation of viruses then became more of an issue often after maybe about 12, 18 months. People would be improving and you think, oh, great. They look like they're healing, they're 75% better. Then they would maybe get a second infection of a cold or maybe an untested COVID, because we know it's still flying around. And then they would really plummet, and then they would continue to plummet and not recover in the same way. Now, some of those patients we now know have co-infection. So obviously, we know that in childhood, we're exposed to many different bugs and viruses that are endemic in the population, as now COVID is. EBV, Epstein-Barr virus, is one of those. Many people in Europe will already carry or have immunity to Epstein-Barr virus, but don't clear Epstein-Barr virus. It can stay in your nerves, often in the brain, and then it can reactivate if you become immune suppressed. So you're dead right, Marcus. If you slowly become more and more unwell, your immune system is busy taken up dealing with spike protein and a reaction to that it gets run down. You then tend to get EBV popping up and taking advantage of the situation, multiplying. And so we test people and we find that actually they're carrying live circulating, replicated EBV. We also find that people have significant reactivations of varicella zoster virus, chickenpox virus. Obviously, most people have had that in childhood, but we know that in shingles, the chickenpox virus, it hides in the nerves. And again, we see people with reactivations of shingles and also high levels of circulating varicella. So herpes viruses, they stay around and they can reactivate and they can cause a lot of problem. It's another immune hit. And so your immune system is now fighting two enemies, one in the front of it, one behind it. And it's really hard for them to recover unless you're treating infection. Then what's interesting is if you then take out one of these co-infections or both, then you then find that then the body can deal with the COVID spike protein and mount a correct immune response better. I forgot to mention Lyme's disease, which comes from insect and tick bites. And so many people have also been discovered to have latent or, sleeping Lyme's disease, which can then reactivate and then can cause significant problems. The good news is we have treatments available, Lyme's disease, for EBV, for reactivations of viruses, and we're looking at some novel treatments like selective oligonucleotide therapy, which can claim to eradicate these things. So we have treatments for them even before we had treatments for long COVID. And if you unburden the immune system, you're more likely to be able to fight off your long COVID and recover good immune function and repair yourself if you dealt with the microclotting and spike protein.
So regarding symptoms, you already spoke about the patients you see is a large percentage has fatigue. Then you hear always brain fog, headaches, gut issues, lung issues, heart issues. And obviously looking like myself after athletes, the question is how do those athletes get affected? How do they present to you? What are their worries?
Of course. Well, I'm a good case in point. I was training for triathlon when I got acute COVID. I tried to go back to exercise maybe 3 weeks after I'd had my acute COVID. And I wasn't hospitalized or ventilated, but I was quite unwell for 2 weeks in December 2020. What I found was I just had really poor recovery. I couldn't run at a normal speed. And I found increasingly that if I did go and do any strong, strenuous exertion, it would lay me in bed with a huge headache. Now, you've got to imagine the picture here is you're on the top of Everest and you're doing, let's say you're doing circuits on top of Everest. You haven't got that. That's the equivalent of training when you have long COVID. So my advice to athletes is, first of all, identify if you have some unusual fatigue or drop in performance and associated maybe brain fog, crashes, strange food intolerance, new allergies, and needing more sleep than normal. And the key thing is to identify that. This may be a long COVID, and 1 in 10 people who get infected with COVID will go on to develop long COVID, 1 in 30 will have more severe symptoms. So actually, if you're an athlete, the first thing to do is rest. I always used to think exercise was the best medicine, everything. And as a exercise bunny, of course, why wouldn't I? But it makes you feel good. It releases endorphins. And it's good for heart, depression, weight management, all this performance, right? But exercise is not the best medicine in the initial stages of long COVID. It's actually the worst thing you can do, and it might take up to a month to recover from a crash, and a crash being an extreme, exacerbation of severe symptoms, which might put you in bed for 3 days, maybe a week. Some people at the extreme end, they'll have to go to a hospital appointment, and that will be so much exertion that they'll have to go to bed for a week. Their system is overwhelmed. So for athletes, identify, first of all, is really key for people in the sports world to identify long COVID early. Continuing to train is detrimental and probably will result in further kind of hypoxic injury and severity. Secondly, I think then you need to stop all training, apart from what we call, give permission to potter. And that just means walk around the house and not doing any heavy exercise, not doing any heavy DIY, just pottering. And that's very hard to do for some people who are very keen to get out there and do exercise. And thirdly, when you feel better, don't just go back out for a run like I did, because you'll end up in bed. And fourthly, get some treatment. Now, we have built an integrated online service, including myself, my colleague, Dr. James Gill, and then we have a nutritionist. We have a psychologist who does vagal theory to help deal with the mind-body link, and various other professionals in our team online, including a breath coach, because we know that all these things may go wrong. So we need to actually form a plan around the person who needs to get back to high performance. And whether it's a CEO or whether it's an athlete, approach is often similar, because high-performing people actually struggle to maintain and manage their own expectations. They want to go out like I did and continue exercising. Not just exercise, it's actually mental exertion, social exertion, emotional stress. These things actually can lay you in bed as well, because your brain is still working at a high level. The symptoms can last a long time, and unless you stop. The evidence on my initial research on our patient group is that those who rest early recover quicker.
Okay.
So it's really important to recognize this.
It's actually a good point, because I've also been reading that obviously type A persons, people who are always stressed and running around, obviously they're more prone actually to get long COVID, and also they probably are also the harder to recover, because they always want to do everything quicker and better earlier.
Of course. And I think there's also, here's the thing, a type A person may be prioritizes performance and productivity over maybe self-care sometimes, and we're more vulnerable to neglecting our own health in favor of goal. We're always driven by or pulled forward by something. I'm one of those people. I'm running a national company. I'm a busy guy. We grew 200% last year. So of course, it's hard to rein in those emotions. Also, the people around you and the expectations from family, from work, from friends, from colleagues, from your people in your sports team are also really important to manage, because those things can be very stressful. If there's expectation laid on you when you get out of bed and people don't realize you look normal, you might look fine, and yet what they don't see is all the sleep, all the preparation that you have to do just to deliver. I was, for example, if I had been doing this podcast when I had long COVID, I would have had to go to bed straight away after I did it, and I would sleep for 14 hours. And I would have had a huge migraine. Now, I never suffered from migraine before, but I now know I actually have a part of my right brain here that has had a hypoxic injury from a Q EEG, which I just had. So, so we know that even just thinking, the brain needs a huge blood supply, and so we have to be really careful to manage expectation. And I think, along with chronic fatigue syndromes, those type A people are more at risk of these things, and they may be more vulnerable. We see associations with neurodiversity and with long COVID. We see associations with hypermobility, previous allergy, people who've had multiple infections in childhood, or people who've been born by cesarean section. Again, the gut microbiome and your genetic risk. And I think, those people often are the geniuses, the productive people in society, but they tend to have more of a boom-bust metabolism. Sleep is a huge, important thing we need to address, and often people like that, they need less sleep. They probably still need to get quality sleep, but don't sleep properly, your cortisol levels go up. What is cortisol? It's an inflammatory stress hormone, and this then creates a huge impact on your sleep.
Great. So I think let's speak about possible treatments.
Yeah. So I mean, I think what interested us, Marcus, when we connected over this issue was I'm quite broad in my approach. I'm a family doctor, general practice doctor, but I recognized the allergy system was wrong. And I also recognized the gut microbiome was wrong, because many people have acid reflux or constipation or diarrhea. I also recognized that the microclotting, the vascular system was wrong. I had very strange, I get cold hands and feet, the COVID toes, I get new migraine, I get palpitations. So there's three major systems here to look at. What I tended to do was start with the lifestyle. So there's a sort of anti-inflammatory lifestyle that I recommend in our treatment protocols for the clinic that will help everybody. And actually, this is good for any top exec, any athlete, any person who wants to perform well, to deliver the best performance in their body. So anti-inflammatory lifestyle, what's that about? It's about nutrition, making sure that you optimize all the key nutrients. The key ones in long COVID being vitamin D, zinc, magnesium, vitamin C, and then other things like iron metabolism, B12 and folate are kind of key elements here that we can test for and improve. They then feed into the blood system, help us to create red blood cells, to repair, to reduce inflammation overall. Other things nutritionally we think about is what are we putting into ourselves. So we avoid ultra-processed foods. We often reduce gluten, and we advise reduce histamine in our diet. So things like bananas, a lot of athletes eat, high in histamine. Shellfish are also high in histamine. Avocados, sadly, which are often part of keto diets, which are great, but avocados can be high in histamine. So we look at the diet and nutrition, and we use our nutritional therapist, Natasha, to work closely on that. We often do gut microbiome analysis and find out which of these little, bacteria groups are lacking. So the histamine regulating bacteria, they often get knocked out. The bacteria that are involved in metabolizing tryptophan, melatonin, and serotonin, they often get knocked out. Make sure treating these at finer points to improve serotonin, because mood often falls, and melatonin, sleep often goes out the window. So we look very closely at the gut nutrition first. We also combine that in people who are willing, and sometimes athletes are more willing than the general public, to try things like breath work. So we recommend box breathing and other types like Wim Hof breathing if possible. And we combine that with cold water immersion or cold showers. And I know, Marcus, you've tried some of these things.
Yes, so I'm actually, and meditation you haven't mentioned. I think, to calm down your nervous system, meditation is also a good one. And I think the stress element you said, which can cause some of those symptoms, are turned down with meditation, Wim Hof breathing, and cold water immersion. And,
exactly.
And when you come to medications, I know we don't give any medical advice here. It's just a discussion for entertainment. But what medications are out there which have some evidence?
Interesting. Yeah. So early on in acute COVID setting, various medications were thrown at people who were very unwell, and some of them came back with positive results and preventive results. So coming up the charts, we have Metformin, which was a diabetic medicine that improves insulin sensitivity, which can be part of the gut problem we have. You also have things like ACE inhibitors, and we know that the ACE receptors are involved in acute COVID and the problems there that you have with the receptors. You also have aspirin. Now, aspirin's as old as the hills, comes from willow bark, a very old pain reliever, but actually it's a mild blood thinner and can work very well as an antiplatelet to stop the blood cells being so sticky. So this has great benefit. Nattokinase is an extract from fermented soybeans, and this can help also to reduce the buildup or break down microclots as a nutritional supplement. Moving forwards, we then find things like antihistamines can be helpful to control the histamine response, particularly things like fexofenadine, ketotifen. Ketotifen goes into the brain, which can be very useful in some people. We also sometimes find that we have SIBO, so overgrowth of the wrong bacteria, and we have to treat that sometimes with antibiotics or with a dietary change. We also find that in some more severe cases, we have to go a bit further into the immune system. And just to clarify as well, we have to rule out any other autoimmune conditions. So we should, as a baseline, be checking for heart, are there any other problems? Getting an ECG as a baseline, maybe an echo scan. And for other organs, we might function with a full set of blood tests. Kidneys sometimes go off, liver function sometimes goes off. So then we're thinking more in the more severe cases, right? How are we going to clear COVID spike protein? And monoclonal antibodies have been coming up the charts because they can attach and get rid of the COVID spike protein feeded through the body blood vessels. And we see some good results with that. I mentioned selective oligonucleotide therapy, SOT, which can target Lyme disease and EBV and other co-infections. Also can be useful, but is relatively in its infancy. There's not much known about it. And then stronger medicines that may help you to block the inflammatory response. Things like Maraviroc, which is a CCR5 inhibitor, which Bruce Patterson in the States has been using to good effect in some people. Reduce levels of vascular inflammation, which is by VEGF, which is released when your CCR goes down. So some of these things are becoming more and more, complicated, potentially more high risk. And then, of course, anticoagulation. So we are finding the triple therapy was recommended in the papers from South Africa from Stellenbosch. So we find that some people do require apixaban, aspirin, and clopidogrel, and maybe even sudexide to control the microclotting response that they're getting. And the list goes on. That is also lifestyle stuff, psychological work. You mentioned, on a basic level, maintaining your own emotions. I recommend journaling and gratitude, which is a strong psychological tool, right up to psychotherapy, which we deliver online using polyvagal theory to help identify the mind-body links and to control the dysautonomia and our sort of flight-fight response tends to kick off when we see a symptom or when we get a crash. You can dampen that down by training yourself into calming thinking, identifying negative. So there's so many allied things that you can do. Last thing, just very exciting. We launched our clinic in London, and we have the red light therapy machine, photobiomodulation, which athletes may be familiar with for recovery, for restoration after a workout, or to prepare for a big session, maybe a triathlon. And this is also very good for any inflammatory condition, chronic fatigue, all kinds of inflammatory conditions can benefit from red light therapy. So this is the latest one that I've been looking at. Plus things like acupuncture, which can just help, globally to balance out the system. The list goes on, Marcus. There's so many possibles.
So, but to summarize, basically, COVID and long COVID is a complex disease, which basically has multiple facets, which can affect multiple systems. And therefore, I think the treatment is targeted to the individual.
Absolutely.
And because there's only limited research in some, obviously the starting point is always lifestyle, self-care, and those things. And as a last point, obviously you offer all those in your clinic.
Absolutely.
And that's your holistic approach. And
Absolutely. So we're very holistic in the clinic. We're very integrated in our care. We don't just treat symptoms, we look for the root cause. And we've built a full range of people online and face-to-face who can help deal with that in anyone who may be suffering. We're happy to have a call with someone, a discovery call, and I'm sure we'll be able to add something to their care. We'd always recommend being guided by a trusted physician in this area because it is so complex, and we are treating hundreds of people to help improve their recovery, and seeing people getting better like I did is incredibly rewarding, and it's great to see families, you know, beginning to function again, people beginning to get their lives back, because so much is lost. And so we've actually created some educational resources for this. So we're talking to employers, and we're developing courses for people to understand long COVID and to understand how to help as a carer, as a patient, maybe as a CEO or as an athlete. And so please do check out our blog, our website, our TikTok videos, because we're constantly producing resources here to educate and to try and share the knowledge on what is a very complicated illness.
Okay, thank you very much for your time. It was great. Maybe in a year or two we can repeat this and see what research has given us as more answers. Thank you very much,
Thank you, Markus.
Dr. Ben. Thank you.